Good morning to you in Australia, my friends, and good evening to my friends in America who is supporting this webinar. Thank you to all of you. I'm Vivian Silva from Brazil. Joining this webinar are Dr. Manuela Malta, who is our global manager, and also our team of specialists. Jesse Escobar from Mexico, Carlos Aguilar, also from Mexico, and Vinicius Santana from Brazil. Thank you to you to help us with the chat. I would like to thank the Australia team for this opportunity to provide with you this presentation. Simone, Natalie, Kat, thanks for everything. I also must remember that Ana Carlos Aguilar and Ana Midense for supporting this webinar. You both are really great. Well, let's begin our webinar. I'm gonna share with you my screen. So, it's okay? You can see my screen? Let's wait for moments. Okay. So, I'd like to introduce you today to the Laureate learning model for instruction and function. We are going to talk a little bit about how to facilitate learning sessions using different methodologies, technologies, and tools for teaching structure and function. In this moment, in this first phase, we are right here in this level. As you can see, we are going to have some steps in this training. We are here in the phase 1 of the Leadership Development Program for Structure and Function, and we still have phase 2, phase 3, and also phase 4 with a hands-on workshop. So this is just the beginning. This presentation was prepared to have 5 parts. It is divided in 5 parts, and we will discuss in part 1 why integrate learning using new tools for structure and function. Well, as this is our Laureate learning model, this is the chart that designs our model, and we have 5 principal, most important axes that are the systems integration, interprofessional education, simulation labs and methods, strong external links, and high-quality clinical and professional education. Our axis, our knowledge block is here, is the new structure and function, and it's a very important part of this model. So we are going to, at first, to discuss a little bit why integrate learning using new tools for structure and function teaching. Well, to answer this so important question, at first we need to review the historical changes in this area. I'd like to discuss with you this paper from Harden, 1984. It's really amazing to observe that Harden and colleagues proposed a new way to organize the health science curriculum in an integrative approach. There are about 20 years already, when the knowledge of the body in this approach and the attitudes, feelings, and all the soft skills are learned at the same time, just like in the real world. Harden named this model as SPICES, and this is an acronymous here, as you can see. The S from student-centered teaching, the P from problem-based learning, I, integrated curricula, C, community-based learning, E, electives with a core, and as systematic curricula. Well, these all 5 points are really important for us, and the curricula in the Laureate learning model have this approach. They are not following a traditional approach, but a more modern, or not so much, if we consider that this has already 20 years, so it is no more so modern, but something that's really all around the world. The curriculum integration is the basis of the Laureate learning model, and it is evidenced by our knowledge blocks that you can see in this picture. Instruction and function block is colored here in orange and includes all the morphological and physiological sciences. To better understand this division in curricula blocks, I brought to you an example that is the nursing curriculum. And you have here all the blocks of the knowledge, structure and function in orange, and here we have all the teaching units that are part of this knowledge block. Well, the structure and function teaching units block begins at the first period with the structure and function and human function, and goes on to the 5th period with other teaching units like nervous system, locomotor system, urogenital, cardiorespiratory, digestive and endocrine, and the clinical and the pathological integration. As you observed in the curriculum, one of the characteristics of this curricula, of this way to teach, is the division in body systems. We have a division that is in organs and systems, and this is also a characteristic important from our structure and function model. So all the sciences that compose this block of knowledge are anatomy, the embryology, the histology, that compose the morphological sciences. Together these, we have the physiology, that's the function, and the pathology, that's the dysfunction. And always together our approach, we have the clinical application. This is something that's gonna be always present in all the parts of our curriculum. So, one can ask, what else is part of this model? We also compose our structure and function model using, besides the integrating of different disciplines in structure and function, we also use the active methodology and the integration between structure and function knowledge and the clinical practice. So you see that we have many parts that integrate our structure and function model. We have the curriculum divided into knowledge blocks and into organs in body systems. And we also have these 3 axes that are the active methodology, integration between structure and function knowledge and clinical practice, and also the integrating with different disciplines in structure and function. Well, at second, we can speak a little bit more about the tools that are part of our teaching methodology. Well, one other question that we can have is why to use this model of teaching? Well, the papers in the literature show us, and also our experience, that This model of teaching empower learning and permits that our students learn the most relevant and pertinent content, permit them to do a significant learning, the knowledge that they need for the clinical practice, allows them to learn the softer skills, and this is really very important for this generation, that are the interpersonal relationship, the teamwork, responsibility, professional attitude, ability to solve problems, and also permits the curricular integration and allow the horizontal and vertical integration between structure and function and the clinical practice. Well, these 4 points are really embasing why we are using this methodology. Well, at Second Soul, we are going to speak a little bit about the tools that are used in our curricula. We have this at first, we are going to analyze how anatomy education has been constructed through the years. This is a timeline from the anatomy education that we really like it. It's from a paper from the Acta Médica Portuguesa. And if you look at what is happening during all this time, from the 5th century before Christ till the last century, we are going to see that the study of the anatomy began with the cadavers at the Middle Age here with Mandino. And we have used this tool that is the cadaver until nowadays. And we have to introduce some textbooks that were really important, but still in a very focused in the body dissection. For the last century here, we have we have noticed that there was not a significant change in the way that we teach. Despite the introduction here of the video surgery, the ultrasound, of the diagnostic methodology, the teaching of anatomy did not change so much. It continues very traditional with the body dissection. Well, what class is this? Is this a class from nowadays or a class from 4 centuries ago or 5 centuries ago? Is this class different from this class? Well, they look the same to me. I don't think we are introducing the technologies in the anatomy teaching as we should, as they are developing, they are available to us. Why is it so difficult to improve morphological education with the advance of the technology? Why we take so much time to do it? Well, around 15 to 10 years ago, the winds of change began to blow for the morphological sciences, and some advances in the technology were introduced to the teaching of these sciences. Well, this is our lab in Brazil. This is a class of structure and function, and we think we are redesigning the way that structure and function has been taught for more than 400 years. Can you see how interested are they, are the students? They are paying much attention, aren't they? And this is just the first moment of the class. In the second moment, here they are in a very active way working in learning stations. we think we are personalizing instruction and function learning through multiple pedagogical resources. And this is also a key point of our methodological approach, that we are using this multiple pedagogical resource for the teaching, in contrast with a traditional approach where we use exclusively the body dissection. Here you can see the students doing some living anatomy, case studies, here using the ultrasound. And after all, we are doing the context clinical. And first they learned, for example, what are the valves of the heart, and then they learn where they are in a living body and study its function. So it's an applied teaching, applied to the health scenario, through the health professional scenario. And so you are bringing relevance to the class. We are keeping the teaching, the structure and function education relevant to our students. They know why they are learning something. They are not just memorizing many points, many anatomical accidents just to write an evaluation. They are really learning something that's going to have a significance, a meaning for their professional life. With these multiple pedagogical resources, we are advancing the culture of innovation, and this is a very important characteristic of Laureate. We want our students be together everything that's more modern and innovative, and that this can bring more relevance and more better delivery of health professional sciences for our students. Well, we consider that this is part of the Laureate movement, that they are really having the DNA of Laureate. So let's see in practice what the Laureate learning model is for structure and function. Oh, I like this picture. This is an ecosystem. Well, today we have been talking a lot about the learning ecosystems, and to understand this, we need first to introduce you to biological ecosystem. Well, science defines an ecosystem as a biological community of interacting organisms and their physical environment. The balance between these components leads to success. And how can I transpose this concept for the learning ecosystem? We consider that a learning ecosystem is the combination of technologies and support resources available to help individuals learn in an environment. So we want to provide an ecosystem learning for our students. And we consider that this is our ecosystem. An ecosystem is composed by people, organisms, alives, and the things that are all the technologies and the tools that you can see in this class. So this is a complete environment for the learning of our students. They are here, they were there in this picture here, in a practical class divided in the learning stations where they are practicing the living anatomy, case studies, ultrasound, 3D anatomy, and the dissection. So this is really an important concept that we want to share to you. That's the concept of the learning stations. In the Laureate learning model, these stations allow to our students a completely full visualization of the topic we are studying. They are completely immersed in a subject and they can have a complete experience on it. Our learning station reinforces the concepts presented in other formats. So the students can learn, for example, the cardiac function in the auscultation, and also to see the heart cycle in an ultrasound. The learning stations are dynamic, promote discovery and exploration, motivation and enthusiasm, and they are really very nice. The students get really very enthusiastic when they learn in these learning stations. It provides also synesthetic learning opportunities. They have to be hands-on. Remember that we work with the active methodologies, and they provide opportunities to integrate structure and function information. We think that this model of learning are much more interesting to our students than the use of a unique tool like the body dissection. So they can taste all these tools in only one class. Oh, I like this picture so much too. It's from a lab where you can see many learning stations that were created for a class. And in the picture above, you can see here one station for the ultrasound. In this way, one station also for learning the radiological images, but here in an app, in the laptop, this is our living model, and here they can study something that is inside the body. If you can look at the picture below, we can see here the other learning stations. Here in these laptops, we have a station of histology, where they can see the virtual microscopy, and here a learning station of physiology, where they are using an app that's called PhysioX. And here two very technological tools that are the interactive table for anatomy, and here the 3D anatomy dissection. We are going to talk a little bit more detailed about each one of these tools in the second part of our presentation. For a while, I'd like to share with you some points that are really important. We believe that the Laureate learning ecosystem is connecting people, and this is really important for our students because they are going to work with other peoples, and they need to develop the soft skills, the capacity of to interact with other peoples, and to apply all the things that they are learning in our labs. They are learning how to work in a collaborative manner. And here you can see that they are really happy and that they are really enjoying this kind of methodology. This methodology also understands the digital environment in which our students live. They are the millennials and they work really well with this kind of tool. It takes all their attention when we use some tool like this during the class. Well, here we have the students use the interactive table. They can do the cuts and they can apply filters for studying, for example, the mesenteric vessels. Here you can see the students learning the anatomy of the abdomen. They are proceeding an ultrasound of the kidneys. Can you see the kidneys here? And look a little bit more above, it was the liver. So here they are learning, for example, how to localize, how to locate the organs inside the abdomen. So it's a very nice tool, and the students really like when they proceed the ultrasound in the class. This is an important point that you can see here. That's that the Laureate learning ecosystem is supporting the learning process with the right broad range of content and in a guide on the side way. You can see here who is proceeding the ultrasound. The students. The student is the patient. The student is proceeding the ultrasound, and they are discussing among them what they are seeing. The teacher is beside them. The teacher is supporting the learning, but the teacher in this model is never the center. The center are our students. They are the most important part. The teachers are always together then, supporting and guiding their learning, but never doing for them. They need really to be very active in this methodology. Here is another situation. Here you can see one body painting of the large intestine, and here a model of ostomia. And the students of nutrition are here, and they are interacting with the living model as if she was their patient. So we believe that the Laureate learning ecosystem is promoting a culture of innovation that ensures not only the cognitive, but also the soft skill for complete the learning success. And here there's also another situation that we really like. This is a workshop for internship professors. Do you see a senior professor here and other senior professors? In this day, we brought the teachers from the internship for to have an experience in the university. They used to be more in the hospital and less in the university. And sometimes in the hospital, our partners have not all these technological tools that we use with our students. And we brought the professors to have an experience on how our students are learning. And it was very nice to observe how they are prepared to support the practice with the technological tool. Think that our students will be in the professional market like from here 5 years or 10 years, and they are really prepared to use these technological tools. They are prepared for the future. And this we have keep in mind when we are talking about medical and health science education. That is really an important ability that they can manage all this technology with these patients. We have in mind that the most important thing, what we have finally in our objectives, is that we want to deliver a better health care for the people, for the community. So everything what we do inside the university is to thinking that in the end they are going to delivering a better healthcare to the people. Well, we arrived to the end of the part 1. So we are going now to open for questions. And let me see here in the chat, what do we have? Okay, let me see here if we have some questions in the chat. No, I can't see here, no questions. Okay. Okay. So if you have any questions, if you want to interact, please write here in the chat. Okay. Let me see here what you are doing. Oh, now it has. It was not new for me. Now, yes. Jessie is saying that all this learning resource prepared our students to their professional life. That's really true. This is very important. Natalie, hi Natalie, how are you? The instruction function learning stations are also mean students, yes, move through different activities. Yes, that's true. So they are simulated by new experiences throughout the class. It's true. And I think that when they are in the learning stations, they are not bored. When we have only one tool in the class, they have to be like 1 hour, 1 hour and a half using this tool, and sometimes they really get bored with that. And we have many tools, 2, 3, 4, even 5 tools in the same class. It really became more attractive to them. No time to get bored. That's it. Really. Yes, Simone, this is important because the staff needs to have the opportunity to be specialized. You are right. We intend with our faculty development to develop these tools with the teacher. Today, I'm going to show you a little bit more how these tools work, but not in details. But during our webinars, we are going to work it with them. And I think this is an opportunity for the teachers because they can learn with us here in Laureate how to manage these tools, and they will get professionally more prepared to work with our students. Hi, and Simone, what is the average size of your classes? Well, this is a good question because we have big classes and the other with is small, number smaller of students. When you mean the average size of your classes, you mean the time? It's around 2 hours and a half, around that. But usually we have about the number of students. We have around 50 students in the median, in the average. But sometimes we have really a big number of students, like 70 or 18, and we have some ways to adapt our classes and our learning stations for this number of students. Simone is asking also how long the students spend in instructional function lab each week. It depends a lot on the curriculum. For example, nursing is spent with us 2 times a week, like 4 hours a day, so like 8 hours a week for nursing. For naturopathy, a little bit less, like 5 hours a week. It depends on the carreira. And what else we have here? Okay. I think the questions are ended, and we can return to the presentation. So soon we are going to have a little bit more time for the questions. Can't wait to start running. How nice, Ashley. We too. We really wanted that you begin as soon as possible with the session. They are really very exciting. This is from Cat Smith. Who can log on to the chat? Okay, how does this translate for students studying online? Do they come in for regular labs or perhaps less regular intensive sessions? Well, we need to know how you in Australia are going to use the online studying, but sometimes they come to the labs presentially, they come to the university to use these tools, but many things can be provided online. So we can have, you are going to see now, we have many tools that are from free access or that they can access by Blackboard. Okay. Something else here. Okay, so I'm going to return to the slides, and from here some minutes we can have another session of questions and answers. Let me share my screen with you again. Okay, here we are for part 2. Well, in part 2, we are going to talk a little bit about the digital resources that are available for structure and function. We begin with the virtual dissection. That's the tools that allows our students to dissect the bodies. So it refers mostly to the anatomy education. This is a tool. I'm going to pass some videos for you to present, to introduce these tools. And at first, this is the visible body. Maybe some of you know it. It's an app. It can be in the iPads, in the notebooks, laptops, and well, you can choose the language, you can choose the part of the body you are interested in, and you can see that the quality, the image has really a very nice quality, and everything is very detailed. So here you can teach your students any nerve of the upper limb or the lymph nodes or the vessels. It's really very detailed. This is another tool. It's a 3D anatomy dissection with pictures of a real body, and you can do the dissection from the superficial layers to the deeper ones with an amazing quality. This is a new product in the market, which is already available in some schools of Laureate network. To use this tool, the students use glasses appropriated for the 3D, and it's really very impressive, the image quality and how well done are the dissections. This is really an amazing tool, and I like it so much. If I could, I would use this every day in my classes. This is the interactive table for anatomy, and It allows our students to use the radiology to learn a little bit, mostly about the anatomical variations, since they are studying in exams of real patients. So you can see here, this is in here, above you can see the interactive table, how it works. And here are the images that you can see. So we can teach our students, for example, how to locate the parts of the lungs, the fissures, and the relation with the heart. They can apply here some filters and to reconstruct it in a three-dimensional way. I'm going to show you also some virtual microscopy that are really very nice tools. Well, the virtual microscope works like an optical microscope, and the students can use it, access it in a free manner from their homes. And this is really very nice that they don't need to be at the school for to analyze, for to study the histology. If you can, you could go to PubMed and to see this paper. I like it really very much. They do a comparison between students who learned microscopy with the virtual environment and with the optical microscope, and they notice that the students that learned with the virtual microscope learned so much as those used the real optical microscope, but the ones that learned with the virtual microscope learned still other abilities like to create PowerPoint presentations, to use the web, and other so important things. This is an example of a virtual microscope that is the histology guide. It's from free access in the web, and wow, I really like this kidney. This is really amazing. It has pictures from electron microscope, but it is mostly important and interested in the optical microscope. So you can see here they have the slide box where we have all the subjects we need to teach our students. I'm going to choose urinary system. You can see here the slide box. Let's choose a slide from the kidney to see how it works. And here is the image of the kidney. Besides, you have some text. And so what do you think about the resolution of the images? I think it's really good. This is a very beautiful capsule of Bauman's. And well, the student can do this with us in the university, but they also can do this from their homes. And this is really very nice that they can have a remote access. Look at these cuboid cells. They are just perfect in the collecting ducts. Wow, it's really beautiful. Yes, I like that. We have other virtual microscope too. I brought here some examples for you. That's the Lumen from the Loyola University. This one from the Michigan University. They are really also very good microscopy tools. Another subject that we need to talk when we are talking about digital resources is the augmented reality. That is something new for us, but it really has some good devices. This is also from Visible Body. And wow, this is a way that our students like to learn. This is exactly what they used to do in their homes with their own devices. This really catches their attention. This other, the HoloLens, is being developed by Microsoft, and it has a scenario that I want to point with you. You can see here a person that's an avatar of a professor, of a teacher, that's called Mark. And here are the students, and they are studying the brain and the fibers that connect the different areas of the brain. And so they are doing this in their homes or, well, whatever, in any place they could be learning this. And if they have some doubt and they need the professor, the teacher, to clarify it, they can call the teacher. And here is the teacher. Let's play the video for you to watch. And can you see here the teacher is teaching them. So this is something that we have to that has to be in our minds, that in the future we are going to have an environment like this. Maybe in the future this will be the learning ecosystem in the house of each of our students, in any place where they want to be. And as some of you asked in the chat, like an online tool. So augmented reality is something that we need to introduce to our students in the teaching of structure and function. Well, about the virtual experiments, we have used it in our labs in Laureate, the dry labs for physiology. We cannot accept anymore that the animals be used for teaching the undergraduate students in physiology. This is no more accepted, and the animals have been replaced by the technology. So I want to show you some virtual experiments that are really nice. This is PhysioX. PhysioX is an app from Pearson, and it has many virtual experiments. That's like the traditional experience, but the students can interact with it. For example, here, let's play the video. Here you have the heart of a frog, and the students can learn the heart activity, if it's normal or no. They can give some drug to this, to apply some drug to this heart to see what's gonna happen with the heart activity, the heart rate, and so they can analyze how the drugs work on it. It's really very nice. This is another tool that's also a virtual experiment, a little bit less interactive than PhysioX, but also very nice to understand how the synapses work and how the drugs can affect the receptors and the release of the neurotransmitters in the brain. So here you have, this is from it has free access. You have here a party, and the mice are using drugs. Can you believe that? This is using marijuana, this is using alcohol, cocaine, and well, let's see what's happening in their brain. The students can choose one of these mouse and to put their brain in the centrifuge to see how the drug is working. Let's choose the one who's using, okay, marijuana. Let's see. It's funny for the students, but in fact, what we want to choose for them is how the drug is affecting the receptor, the cannabinoid receptor, and that this neuron, when it is affected, can no more inhibit the dopamine neuron, so that dopamine is being released in great quantities when the individual is using marijuana. So what we want to teach our students here is how the synapses work. And this app provides them a nice environment for that. They get paying much attention on it. Well, this is another site of free access from Monash University, your neighbors. Maybe some of you know them. I met this site and the authors in a Physiology Congress, and the site is really very, very good. And for example, here we have many virtual experiments in different areas. We can choose, for example, to see how the action potential works. First, in the site, you have a theoretical part, and then we can try to create to stimulate an actual potential. So we are choosing the intensity, they 10 nanoamperes, no, not enough, not in the limit. And so the students can be choosing each time with a more intensive stimulus. Yes, with 20 nanoamperes, it really works. Let's try a little bit more, 25, and look that the action potential has the same amplitude. It's going to 30 millivolts. And as the students are working on these, are interacting, you can discuss with them, for example, what is a linear for neuron, what is, why all the peaks independently of the intensity are always the same. So we can discuss the physiology with something that is interactive for our students. Yes, this is the Power Lab. This is from New Zealand. Maybe you know too. I think that you have many of these devices around New Zealand and Australia, and in Laureate, we really like it. The Power Lab is a device that allows the students to capture the physiological measurements you see on the spirometry, and they are capturing this data in the labs from one another, one student with the other, and they can analyze the data they got in a platform, in a cloud, that's called LT, that's Lab Tutor. And this provides a physiological experience for our students, and that they can get to deep cognitive objective. It's difficult to analyze the data acquired with the Power Lab. So it's indicated for a deeper approach of the physiology. Well, that's it. I really like these devices, that's the technological tools. And let's see the chat if someone has some question for me. Let's see what we have here. We are familiar with visible body software and our lectures use it for online. Good, very good. Okay. Kelly Galvin is saying that, have you done any research regarding the students' experience use the tools, and if any tools are more effective than others? We have some students about this, Kelly Galvin, but if you go to PubMed, you can find many students comparing how the students learn better. You can also go to our toolkit in the faculty development site of Laureate, and there we have some papers that show these results. Okay. It's an important question. We want to be sure that we are really delivering the best learning experience to our students. I really appreciated this question. Do you use a problem-based learning design for online curriculum using these tools? Well, we have very few online curriculum in our experience in Brazil, but in North America, they have more experience with that. This approach, we like it very much, but when we talk about a problem-based learning design that is completely based in tutorials, maybe this will not be the best approach. We believe that the best approach is the one that combines different methodologies. So the PBL can be a good methodology, but you also can use the case study and other methodologies like TBL that are a mix of methodology. Maybe this could be more attractive to the students, although the online curriculum. Simone, although the technology is great, it's how it appears to really enhance and enable better understanding in the deeper learning versus just surface learning that I love. This is an important question, Simone, that when our students go to the learning stations in the lab, for example, that they don't stay just 10 or 15 minutes in each station. They need to be there at least for something like half an hour to be able to develop some deep learning. And so really, we really need to take care of this. Dr. Gutierrez. Dr. Gutierrez, you are here. Thank you to you for being our audience. Oh, very nice to see you here. Okay. Okay. Catherine is asking if this includes simulated histological sample preparation process. We have not a simulation for the preparing of the slices, but this can be really very important for some professionals like the biomedical and the biologists. So this is something that we can look forward. Yes. Carlos loves mouse party. Me too. Okay. Workstation learning activities, a flexible and scalable instrument. Great, Jessie. It's true. We can have groups, small groups, like 30, 40 students. We can also have big groups like 80, 70, 80 students working the stations. Okay, I think the questions are ended and we can come back to the presentation, okay? So in some minutes we will have another session of questions and answers. Let's go to the presenting. I'm going to share my screen. So here it is. Okay. Well, this is part 3, the tools for structure and function. We are going to talk a little bit of living anatomy. Living anatomy is really a challenge for us. Well, during all these years, I've been working as a teacher, a structure and function teachers. I work as a teacher around 20 years. I have noticed that even the best students who have nice grades and knew everything about the skeletal accidents, the insertion of the muscles, well, even these ones that had really good grades, when they go to the practice, the clinical practice, they have difficult to to apply what they learned about anatomy with their patients. So then they could tell me everything about the liver lobes. But when we asked him to go to the patient and to palpate where are the lobes, this was really difficult for them. It's a learning gap, I think. They know very well where the structures are in the body dissected, but they cannot apply this knowledge to the patients. So we have been thinking a lot on how to solve this issue. And we think that the living anatomy can help our students with this gap. We begin to talking about the palpatory and surface anatomy. That's the most important part of the living anatomy tools. That includes palpation, as we said, inspection, percussion, auscultation, and the study of the musculoskeletal movements. The researches, the papers in the literature shows that the students have little knowledge of the anatomy when it should be demonstrated in vivo, evidencing an incomplete formation in these subjects. The gap I told you. This is really something that we need to care during the formation. This is learning station of palpatory, and here you can see that the students are working peer-to-peer, and they have to take off their clothes, and they have to do inspection of the surface of the body. They have to palpate the structures, and they have to learn how they are going to approach the body of the others, how they are going to touch the body of the other. And we can teach them this in the structure and function block of knowledge. They don't need to go to the clinical practice to learn this with the patients. They can learn this together us in the structure and function lab. Here, another tool of the living anatomy, it's the auscultation. Can you see here that the students are using a guide? This is an important point of our model. If we want our students to be really active, they need to have a good guide. If they need to ask all the time to the teacher what he must to do, this is not an active methodology. The students need to have a really good guide where they can follow step by step what they are going to be doing during one class. Body painting. Body painting is also a tool from living anatomy. You can see here a very detailed painting that can show exactly where are the structures in the body. This is a body painting from Laureate. You can see here the large intestine, And this is a simulation of an ostomy that it looks very real to me. So when we do this with the students, we are not just teaching them where are the parts of the small intestines, but we can also discuss with them, for example, what's the function of the large intestine? What kind of diet I have to give to this patient? If my student is from the nursing course, I can discuss with them, for example, what kind of care with this ostomy he can have. For example, the cleaning of the skin and the danger of infection. And so we can bring to the structure and function lab the clinical context. And here we are not just teaching the basic sciences, but also we are giving them a meaning. They are learning how they are going to use this knowledge in their real life. And this is very important. Our students need to learn in a real world, applicate in the real world, everything what they are learning with us at school. This is the body painting of a muscle of the thigh, the quadriceps, and I really like it because you can see here the how beautiful are the fibers painted in the real position that they are in the body. And we can see here the tendon getting to the tibia, so that we can ask this model, the living model, to do the extension of the knee, and the students can observe how these fibers work, and also these ones. And we can discuss with them why they are located in different positions. And we can discuss with them in a very applied way what is the muscle contraction, why they need to know this. It's a very nice class. Oh, this is the body painting of the mimical muscles. We use this a lot with the students of the beauty school. And so we draw here all the muscles and ask the living model to do all the mimicals he can. The paper of the students is to tell us which muscles are responsible for each facial mimical. It's a very nice class too. The students really, really love it. Well, this is body projection, a very simple tool, no costs, and we can do it almost in all the classes. Here you see a model, and over his body we have a projection with a media, with a data show, a projector. With you can choose any image you can project here, and the objective is to show where are the structures in the body. Here we have, for example, a projection of the heart with the bones of the thorax and the vessels, and we can choose, we can show to our students where are these structures. This is a real class. This is me. This is the projector. These are our students. I think they are patient. They are paying lots of attention. And this is another student that is here. And with the projector, I am projecting in his back the muscles. Something that's around this. In this example here, in this side, in the left side of the back, you can see the superficial layers of the muscles, trapezius, grandiodorsalis, and so in the right side, you can see projected a more deep layer with the muscles. So we can show the students how many layers we have in the back, but in the back of a real person that is alive. And this is very rich. Another important tool also is the what we call of body plastic. They are the resin models, and this is an important tool for our students, mostly for those ones who have never studied the body anatomy, and they like it. This is a good tool, but not the most important tool of our model. And here we get to the end of one more part, and we have another time for questions. Let me see what is happening in YouTube. Wait a minute, I'm going. Okay. Dr. Francisco, do you have any special rules for or conduct in case during one of the exercise? Oh yes, Dr. Francisco. We need to identify when something is going wrong with the students, and we prepare them for these classes. So, for example, if something like this, a mass or a tumor, appears in a student, and this can also happen with the ultrasound, we use to, in a very kind way, to take this student to a special place and to talk with him. We never, ever expose the students to a situation like this. It's very, very important that the teacher develop the soft skills necessary to this approach. So some schools also use a document that the student signs in the before the classes, that they are allowing that the participation in a class peer-to-peer. This is really important. And we also ask the students that the ones that are being the models during the class, we ask him if they have some problem, some health problem, and so we try to choose the ones that tell us that they have no problem. Natalie is asking if the body painting happen in class, or does the model arrive in class already painted? It's expensive. Well, it's a little bit expensive, Natalie, not so much expensive, but the most difficult, I think, is to find the person who is going to paint. Because as you saw, it's very important that the painting is precise and exactly, and that is beautiful. So I think the most difficult part is to find the artist, the person who is going to do the painting. It really looks great, as is saying here, Ashley. It's a member of the faculty who is doing the painting. Yes, she's a teacher. The person who does the painting is a teacher from the art school, and we find her there and trained her for anatomy. Each school has a different way of to solve this on finding the person who is going to paint, and I'm sure you are going to find someone really good in Australia. Body projection has not to be only in male models, Andrea. You can do it with girls too. We can ask her to come with gym clothes, like tops And so we can project over the top. It's okay. It looks nice. There is no problem. Selene is asking if we use these tools for adaptive testing, learning, design. I don't know if I understand what is an adaptive testing, learning, design. I'm going to think a little bit about this. Another one from Kelly Galvin: can the students see consequence of decisions or of symptoms or structure using simulations? Yes, they can, but not in the instruction and function block of teaching unities. We used to develop these objectives in the more advanced teaching units with simulation. So in structure and function, we don't use to develop these abilities. Okay. Any other question? Let me see here. Okay. All the questions were seen. I think so. Okay, let's come back to our presentation. Well, this is part 4, and we are going to talk about the clinical anatomy. Well, clinical anatomy uses tools that are really linked with the clinical practice. So the students like it very much because they really feel as if they were professionals. It brings much reality to our class and also, of course, the clinical context. The first tool of clinical images that we are going to talk are the radiology images. They are really important. We have already seen the students with the ultrasound. In this school, they have an ultrasound for device for the students to use, but it's useful when you have the device, but it's not necessary to have it. If you can use the simulators that are available in the internet and in YouTube, we have many great images using the ultrasound. But this brings much of reality for the class, and the students really enjoy doing it. We can work with them, not the capacity of doing the diagnosis, but they can see the anatomical variations, and they can also learn the three-dimensionality. For example, where are all the organs of the thorax? Where are the organs of the abdomen? What they are, where they are located. It's a very nice tool. We also use, besides the ultrasound, the X-ray, the MRI, the CT. Well, all the clinical images can be used to teach our students. And it's important to say that they don't need to be medicine students to use these tools. These tools are useful to any course we are talking about. If we are talking about nursing, about nutrition, about naturopathy, about the beauty school, all of them can use these tools to learn anatomy because they are learning the three-dimensionality, they are learning where the organs are located, and they are learning the anatomical variations. They are seeing how people are different each other in morphology. So this is a very useful tool. This app is eAnatomy emails, and I'd like you to see how it works. You can have it in iPads, laptops, PC, and it works like an atlas. The students can study. They have almost all the parts of the body, and they have exams of normal people, and it works like an atlas. They can touch and see the names. They compare the clinical images with the pictures, the drawings. You can choose the language. It's more appropriated to your students. Really, it's an amazing app. Very good. But it's not from free access, it's licensed. Another tool we want to talk about are the surgical videos. We really like it very much because with them, we can show our students how people are inside. And they can see the color, they can see the mobility, they can see, well, everything. For this, we use mostly the laparoscopic videos that are really wonderful. So here you can see the liver with its so beautiful color, and the grass and the fat here, so yellow, the stomach. Wow, this is really amazing. They can see everything inside and how colored they are. This is the uterus. They can see the mobility. They can see where is the rectus, and it's really very nice a very nice tool for the learning, for real learning of the anatomy structures. Medical procedures can also be useful. We have here an example of it. This is an anthropometric measurement. Of course, we are not going to teach the anthropometric measurements in structure and function, but we can use this checklist for bringing reality and meaning for our classes. So here the students have not to proceed an anthropometric measurements. They just have to know, for example, where are the inferior margin of the last rib and the crest of the ilium. So we use this to show the students that why they are learning something, what's the meaning of that. And this helps the students not just to learn, but also to remember for a long time of what they have learned, so that when they go to their patients, they are going to be able to apply everything what they learned with us. So here you can see that the students, they are not proceding an anthropometric measurement. They are just showing that they know where is the last rib and where is the crest of ilium. And we hope they don't forget this for the clinical practice. This is another procedure that is really amazing to teach the air pathways. So here you can see the camera. Let's see the examination. The students can see all the parts of the air pathways working. And for example, they can look here, the opening of the auditory tube, and they get really very interesting and to see how big it is. And because they can't have this experience in an anatomical model or even in a body dissected. They cannot see how it opens when we talk, when we inspire, and it's really amazing to see how the structure of the body is working. The person is talking, and you can see here the soft palate. Oh, it's so nice. And there you can see the vocal fold and the piriform recess. Oh, and it's so rich to use these procedures for them to see the body working and how the structure is important for the function. And so they can do this association. It's really very nice. Oh, more questions now. This was a short part. Let me see what we have in YouTube. Let's go. Any more questions? Okay. Okay, Jessie. The images of body projection are obtained from atlas that can consider masculine or feminine structures. You can use radiological images too. It's true, Jessie. Thank you for your help. And another idea, Andrea. The images that you see in this presentation are from the Adam app. I don't know if you have already seen it. It's a really amazing app. You can find it in the web if you can. Okay. Vinicius Santana is asking if these tools could be adapted to the use in the classroom. Okay, and let me see. Well, Vinicius, they can be used in the class, but we think that maybe body projection, the palpatory anatomy, they are tools that are more adapted to the class. They really are better for this. Tools like that can be used in iPads and laptops are also good tools for this. I think that these are tools that can be used in the classroom. Yes. You're welcome, Andrea. Okay, nice. Very good. So if there is no more question, we can come back to the presentation. Wait a minute, here it is. Oh, right. Okay, the last part of our presentation is about the organization and management of a structure and function learning session. We think this is really important because it treats on how you are going to implement this in your schools. So we think that these 3 steps are a good guide to what you have to do. In the first moment, a class of structure and function has to be introducing a opening of the session. In the step 2, the stations are going to happen and the students will be involved in the activities. And in the step 3, we are going to have a closure of the session. We are going to now to detail each one of these steps for you. And so here are some recommendations in the step 1, the opening of the session, it's gonna take around 10 or 15% of the time of the session. It depends sometimes on the topic you are going to develop with the students. You can take a little more time or a little shorter time, but around that. In this moment, the learning objectives are going to be discussed with the students, and they need to understand what they are going to do in that session. Okay, you are going to tell them some basic concepts that are necessary for the session. There, you are going to explain to them how the stations are gonna work, clarify the doubts, and recommend the active learning. Always remember that the teacher will be besides the students. The students are the center of our sessions, okay? So, step 1, the instructor makes the introduction. In step 2, that's around 50% of the session time, the students are going to work in an independent way. For that, they need to have a very detailed guide. They need to follow a step-by-step in the class plan. So, the academic documentation is a key point for our model. Everything has to be very detailed for them in the guide. Well, the instructor will supervise the work of the student in a guide-to-side way and clarify the doubts. After, in the step 3, we have the learning assessment. That's around 20%, 30% of the session time. And we are going to discuss with the students if they reached the objective learning. Well, we will clarify the doubts finally, and it's a moment that we are going to call your attention for the most important points. Usually, when we are doing the session, that time when the students are in the stations, we are walking around and clarifying the doubts. And sometimes we perceive that there is a point that's more difficult, that the group had more difficult to understand. So in the end of the session, this is the moment to clarify these, to call the attention of everybody, to show and to highlight the clinical context, and also what is really important is to recommend the next class. So we want the students to come prepared for our classes. So it's important that we say them what's the next subject, what they need to do during the week, and to study for the next class. Okay? Besides these 3 steps, we are going to give you some key points that we think are important for the success of our sessions. Well, one important point is the feedback. When the students are working in active methodology, they are following the guide and they are doing many points by themselves. They are doing the research, they are going to the bibliography, and they need to receive the feedback. They need that the teacher be very paying attention on what they are doing. So the paper of the teacher in this moment is really, really important, giving this feedback. The students, mostly the ones that are in the first period, the second period, are still very insecure. And they have doubts if they are really learning and they are really studying the stations what they should. So the paper of the professor, of the teacher in this moment is really important. Another key point is the high quality of the learning stations. Well, this is really important because, like Simone, I think, like Simone said, it cannot be boring. The students have to have something interesting to study. This helps them with the concentration, the dedication, and the interesting. So think about good stations that can really call the attention of the students. Another key point is about the environment. It has to be a positive and nurturing environment where the students feel secure to participate, where they feel motivated, where they can train the soft skills, where they feel free to ask and to try, and if necessary, also to do some mistakes, because the mistakes are also part of the learning, okay? Well, again, here we want to talk about the academic documentation. Academic documentation is really a key point of success for our structure and function sessions. You see here two very detailed guides for structure and function. And you have here a step-by-step on how to use the ultrasound. In this example here, we have an ultrasound of the carpo here. You can see many tendons in the hand, and above you have a picture of it. So we can show the students, oh, this is the sensoris retinaculum, and these are the tendons, this is the nerve. So he has here a good material to consult and to take off his doubts. So he's more prepared to follow this step by step. In the other example, we have a station of virtual microscope, and here we have, for example, the link for the slide. He's going to click this link and goes exactly to this slide. And here you see an explanation, and he has to find something in these images. So in the guide, you have a very detailed step-by-step so that the student can perform it by himself in active methodology. And the structures. Well, the structures are really a very important key of success for our model. One of the abilities our instructors may have are the soft skills. We need to develop the skills necessary to be at the side of our students and not in the center as we used to do in a traditional way of teaching. So we need to develop the professional attitudes, the responsibility, the ability to solve problems, because when the students are free to learn, they bring us many problems. And many times they are asking us subjects and things that are not the theme of that class. We need to develop the communication skill, team working, interpersonal relationship, and of course, courteous. Well, this is really important factors. Well, I finished my slides, and maybe you could go to the toolkit of the Laureate learning model that is available in the One Faculty from Laureate.net. And there you can find more informations about everything what we had said here. Some people in the chat asked for papers and researches about this methodology, and you can find much of it in the toolkit in the one faculty. That would be very nice if you can go there to access. And let's go for one more session of questions and answers. Let me see here. Wait a minute. Oh, here you are. Jessie is saying that the daily practice tools are very important. Students must be able to work independently. Yes, the last slide is acronymous. That's practically for the teachers. It's very important. Dr. Gutierrez is saying here, Professor Vivian, can you expand on how to ensure professional and ethical behavior of students during the examinations, since some of them may be in their first or second year? Yes, this is a point, Dr. Gutierrez. We prepared these students for these classes. So, like 1 month before the first palpatory class, we tell them about how they are going to be dressed for this class. We have a dress code for this class. We ask them to come wearing the gymnastic clothes, like tops and shorts, and with clothes that they feel secure and nice. We used to tell them that nobody is obliged to take off their clothes. Nobody is obligated to take off their clothes, but all of them have to palpate, to examine one patient. So we stimulated them to do that. Before the classes, we asked to the students that have some problem of the skin, some kind of thing that can expose them as a hurt or anything that is not appropriated for to be touched, that they tell us before. And some of them don't want to take off their shoes. Some of them don't want to take off the shirt, and we respect that until they are prepared to do it. One thing that's really important that is said to the students is that they must come with the hair arrested with a ponytail. Yes, that's it, a ponytail, sorry. In a ponytail, they have to cut their nails and not to use big things in the ears, and they really needed to be prepared for this class. And we will ask them to have the same behavior that they would have with their patients. So how would be positioned, how would I touch these students? And this is important. Another thing that's important is the person who is being palpated, who is the patient. And for example, this student that is performing the patient can give feedback to the one who is performing the examinator. And so he can say that, oh, your hand is too cold, or your hand is heavy, it's hurting me. He can give this kind of feedback in a very nice way, in a very kind way. and they can learn with each other these things that we cannot learn with the patients. The patients cannot give us this kind of feedback. Okay. Let me see what else we have here. Thank you so much, Vivian. Oh, Simone, that was a pleasure for me. Very nice to be with you. Okay. Yes, Divya, we are all looking forward to implementation in Australia. Okay. Vinicius is asking us if there is a model for doing an evaluation of this session. Yes, Vinicius, indeed we have two kind of evaluation that we think are useful. One of them is the quiz. The quiz is a very rapid evaluation that can be done at the end of the session, but it evaluates the students only for the cognitive approach, objectives. And we can do other kind of evaluation that's similar to OSC that's used in the simulation to get more skills to be evaluated. Okay. Okay, Natalie. Natalie visited us in Morumbi, and it was very awesome. And she could presentate all these tools working, and I'm sure you are going to be very successful in the implementation. Okay. Okay, Manuela, I am also voluntary to go to Australia. You can count on me, okay? Okay, I want to thank all of you for your time, for being here with us. And we are completely open for you. And for every doubt you have, you can call me or Manuela through Simone and Natalie. And it will be a great pleasure to be with you. Okay? Everybody wants to go to Australia, Manuela. It's true, really. I can bet it too. You're welcome. Thank you so much. Okay. Oh, good. We would love to go, Natalie. Okay. So we have, if we have no more questions, I think we can finish this session. And to thank to all of you, to thank to Dr. Francisco who were here with us and did his so important inputs. And that's okay. And on Thursday, you have the simulation webinar with Dr. Manuela. That will be a great time too. Very good. Okay. Thank you to